what is the next action the novice nurse should take? The next action. That's the bit. That means you got to make one step and then take the next step. I've underlined next action. A novice nurse enters the client's room and finds the client on the floor unresponsive and not breathing. What action would you take? In your BLS, ACLS, when you walk to your patient room and you want to do your BLS or ACLS, the first thing is check for responsiveness. So we check for responsiveness. If the patient is not responsive, you call for help. After you call for help, you check your pulse. And then if there's no pulse and no breathing, you begin chest compression. Patient has been found to be unresponsive. That means the nurse has assessed, did the first assessment. Unresponsive information, you don't need to do CPR because you need some help. You should call for help. Later on, you check for cardiac pulses, and if they have pulse, you give them quick rescue breath. So the first thing you should do after you check responsiveness, call for help so that people can come and help you and take care of the patient. So you need to know the order. Unresponsiveness, call for help. Then you check for cardiac pulse. And nurse provide care for several clients who need consent for treatment, which consent obtained by the healthcare provider, the nurse should question. This is the testing concept. All these questions is about, I call it concept. And then you apply testing skills. I need to question it. And I said, well, consent. What do you know about consent? These are the things when you see it according to buzzword, it should be popping. Consent, question. Why did they ask me about consent and I need to question? That means there's a fact concept you have to know about consent, right? You have to be an adult to give you consent. So like 18 years, more than 17 years, right? After that, and you should not have any medication on board. You should be alert. You should understand. You should give a verbal consent by your own, right? But if you're a minor, you'll be able to give consent depending on your condition. This 16-year-old is a minor. You need wisdom teeth extraction, right? This 16-year-old also need syphilis treatment. It's an STD. The 16-year-old, you need alcohol rehabilitation. And a 16-year-old who isn't, I'm a surgeon, you need surgery for appendectomy. Key fact, if you need STD, your parent does not need to consent for you, no matter your age. So this is good. I don't need to question it. And if you need alcohol rehabilitation, even though you are a minor, it's okay. And if you are a minor and you serve in the military, you can consent for yourself. If you can go and die, then you should be able to consent for yourself. So number one is the one you need to get a consent. The 16-year-old cannot consent on his own. His parent has to accept that. So one is the right answer. And this is assessing a female client in the breast canal, which finding the next node places the client at highest risk for breast cancer. Risk factor for breast cancer is estrogen exposure, so hormone exposure and estrogen. Therefore, any of these patients that has estrogen exposure, that's all you need to do. Well, how did I answer this question? I saw highest risk and I saw breast cancer. And I know highest risk for breast cancer is estrogen exposure. Age, the more you older, the more you get exposed with estrogen. Menarche, if you have menarche late, like 20-year-old before you have your menses, is good. But you have your menses less than 12 years old, is bad. That means you can get exposed with estrogen for a long time. And if it takes you a long time to go into menopause, greater than 55 years, is bad too. If you have a family history of breast cancer, you are at risk. If you have fibroadenoma, there is no risk associated with it. This is a benign tumor. Pregnancy is also protective. Okay, pregnancy protects you because when you get pregnant, you don't get exposed to estrogen anymore. And then dense breast is bad because we cannot tell what is normal, what is abnormal. So 1, 2, 3, and 4, 7 are your right answer. Okay. Number 4, and let's measure the client jugular vein distension at 7 centimeters water. That means pressure above the sternal angle, which finding the next node the nurse should expect an assessment. What it means is you measure the patient jugular vein and it's 7 centimeter water. That means this is a pressure reading, okay? Above the sternal angle. So that's the about 45 degrees. This is what you get, 4 centimeters, 7 centimeters. The normal value is 4 to 4 centimeters. So this is the normal JVD. It's normal. Anything above 4 is abnormal. Therefore, JVD of 7 is abnormal. Therefore, if I see abnormal, that means you're fluid overloaded. Watch which of these conditions indicate fluid overloaded. Periorbital edema. If you fluid overloaded, you're going to be hypertensive. If you fluid overloaded, your capillary refill will be less than 3 seconds. Your pulse should be bounding. You should have long crackles, and your skin should be warm. This is another way of asking the question about fluid overload. So watch for it, okay? Number 5, a novice nurse is providing discharge teaching to a client diagnosed with macular degeneration, which teaching is not indicated and need immediate intervention by the precepting nurse. That means, Baswell, go for it, macular degeneration, right? And I said what? Not indicated, that's all. And I need to what? Intervene. These are your buzzwords, collect them, connect them together. What is macular degeneration? People with macular degeneration, what do they have? They lose their central vision, right? But their peripheral vision is intact because the macula is part of the central portion of the retina. So if you lose it, you can't see straight. So you see peripherally, right? So that's the key. Therefore, the major problem with these people, they will need to have regular exams. Okay, they will need corrective glasses. And then they should not avoid public transportation because they can't drive anymore. So they should be using public transportation. Ensure pharmacy provide large print for prescription, right? That's good. They should avoid tobacco, but they should not minimize vitamin C because vitamin C is what help with the related to carotenoid function. So this is needed, the retina development. So this is good. Okay. So the question say we should intervene. So this one is wrong. This one is wrong. You don't need to intervene. You don't need to intervene. What you need to intervene, avoid public transportation and avoid vitamin C. Those are good recommendations. So once again, 3 and 4 are wrong answers. A novice nurse has attended staff education program on the post-operative management of CAST, right? Which of the following the novice nurse should include in the plan of care when caring for a client with new CAST placed 1 hour ago? What am I trying to confuse with? I give you 4 lines. Usually I don't do that. When I do that, I want you to master how to read long questions. Go for the buzzword. All these novice nurse attended staff education, all is wrong. Clean it. I see CAST. Which of the following novice nurse are clean? All of them. Then you said include in the plan of care for CAST. That's all. So those are vanilla. CAST, plan of care, 1 hour. When you have CAST, and the first thing you know is to elevate the affected leg for 24 hours. After 24 hours, you should not elevate it anymore. So this need what? We said which should be included in the plan of care. This should not be included in the plan of care. Apply ice directly over the affected leg. You should not apply it directly. So this is wrong. Cover the cast with blanket for 24 hours. No, you should expose the blanket so that it can dry. So this is wrong. Turn client side to side, right? But you should not use your fingers because it's going to indent cast and it will destroy the cast. But it's okay to do it so that it can dry, but not your fingers, right? Instruct the client to perform range of motion exercise to improve their muscle strength. So this is the only one answer. There's only one answer there. If you pick more than that, you lose it. But select or apply. If you know the answer, pick it. If you don't, let go. And nurse provide care for a client with this strip on the monitor. Which action by the nurse is a priority? Buzzwords, keywords, priority. And the strip. Recognize the strip. You see meandering features here, right? This is what we call Torsade. This is ventricular tachycardia, but it's polymorphic. Polymorphic is different shapes. right? This is what we call Torsade pointase. The problem is magnesium and prolongation of QT. Anything that prolong QT or you have low magnesium will cause that. Therefore, when you see this, what should you do? Review the client list, medication list. There may be erythromycin, the macrolate, or there may be antipsychotic. Okay, there may be ondansetron, okay, amiodarone. These are all medication that can cause QT prolongation. And therefore, you should review the medication list and see what is causing it. You don't need to call rapid response. You don't need CPR for that. You don't need to give the infusion. You can check their BMP and see if their magnesium level is low, and you can replace it. That's taking strategy and thinking using concepts, which and nurse provide care for a client with new diagnosis of anorexia nervosa, which prescription the nurse should question. Buzzword, anorexia nervosa, prescription question, intentionally designed to help you think really well, right? Buzzwords is anorexia nervosa. What do you know about it? Anything you know, write it down. Monitor the client for 1 hour after meal. It's good so that they don't vomit. Provide journal for a reflective writing so that they can talk about what is going on with them. It's a psychotic problem. It's a mental health problem, so they can reflect on that. Prescription for bupropion, it decreases your appetite. You want anorexia patient not to eat? Yeah, this is wrong. So this is what I will question. The best medication is SSRI. It will make them gain weight and eat. Start comprehensive, they should say, start comprehensive metabolic panel, which means we want to check their potassium, check your magnesium, and phosphorus. Those are the things we have to worry about when they come in because they are very low in anorexia patient due to vomiting. Number 9, a nurse is aware of all client in the emergency room. Which client need to be seen first? So we need to be seen first. Buzzword. I see 4 weeks old, eliminated. Then divide it into 2. What is the problem and what is the condition, right? Condition, problem, whatever. Projectile vomiting for somebody who, after feeding and hungry, this is what? Pyloric stenosis. You have a backing cough and your SAT is that. Whatever cough, whatever you're having, your SAT is 95. I'm not worried about it. Just because I'm having backing cough doesn't mean it's a problem, right? It's a kid's problem, backing cough. It's not good. And therefore, but at the same time, you're looking for signs and symptoms that is usually really bad associated with this problem. Do you know what is backing cough? Who does a backing cough? And what condition causes backing cough? And ask yourself, hey, if this is backing cough, what condition is that? This is croup, right? Croup is the cause of back, and that causes backing cough. But so far as their side is okay, it's good. A kid who has severe wheezing at home for 2 hours now is resting is bad. This is what we call silent chest. You are resting after wheezing for 2 hours, something is wrong. You're getting tired. This patient may have asthma. Client with T-colored urine after strep throat, this is post-strep to glomerulonephritis. It's no problem. So 3 is dangerous. That's the patient we will see. Number 4, and this is aware of for client with in the emergency room, which client to be seen first. Okay, which client need to be seen first. So the same thing, divide it, see the condition, I see pharmacology. This is how you do prioritization. You got to be sharp. I see pharmacology and the condition. So circle it. Pharmacology, till my eyes on those 2 things. For phenazine, and you have severe muscle spasm, that is this acute dystonia, right? Fluoxetine with weight gain is unexpected finding, right? Citrulline and with clonus, this is what? Think about it. This is what? Serotonin syndrome. Now, tryptylene with xerostomia, dry mouth. A, don't worry about it. Expected finding. This is bad, acute dystonia and serotonin syndrome. Serotonin syndrome is worse than acute dystonia. Therefore, number 3 is your right answer. This is how you do test-taking strategy using concept to answer this question. Thank you for subscribing. Thank you for being a member. Bye.